Center. We're going to be going over some dry needling today. Here is Dr. Lang. We're going to get this started.
Okay. Is this live?
Yes.
Okay. Not a recording.
No.
All right. So, what we're doing is we're doing a little dry needling, and it's something new we've just started doing here recently. But what we're finding is that it really helps with a lot of trigger points, chronic trigger points that are giving patients a lot of pain, muscle spasms, tight areas within the muscle that get referred pain. So these trigger points will develop in these overworked areas of the back and neck, and then they can refer pain to other areas of the body. So Lindsay here has had a few trigger points, and I've palpated her skin a little bit, so it's a little bit red just from locating a few areas and some knots that we're going to see. First of all, of course, you want to clean the skin, make sure everything's sanitary. And then when you locate your knots, you're using a very thin filiform needle, okay? Now this is an acupuncture needle, and they're very thin, okay? Now there's different gauges of acupuncture needles that we use depending on the area that we're needling. So if we're doing work in the hips or the lower back or an area where there's thicker tissue, then we'll use a longer needle, okay? But this is a fairly thin, relatively short needle, and we don't have to take these very deep. We just take it right into the muscular knot. And then when we hit these knots with the needles, it has a tendency to have a neurologic chemical effect on something called acetylcholine. And that's what creates these knots, is when acetylcholine is too active in an area of a muscle fiber, and so the needle can break that activity up at those end plates, and then the knot goes away. It just dissipates. So the symptoms resolve pretty quickly. So here we're just going to go right in this area through here. This is her left shoulder blade, so we've located a few basic knots here. And this is a fairly painless procedure, okay? The main risk that you run into with doing dry needling is there could be a little prick on contact, but hardly any, because the needle is so thin. And can you even feel this, Lindsay?
No.
So she can't even feel this. Okay, so we just go in, and when you feel the needle pass through the skin, you then feel it hit the taut band within the knot, and she can feel that. It's a little bit of a pressure, and we leave it right there, okay? Once it evokes either a twitch, we get a twitch response in the muscle, or we feel the muscle just sort of start to dissipate. We feel it right in the knot. It'll make that go away. So we'll come around the top part. And we got one right through here. We're just right in the traps are a really easy, common place we see for these trigger points to develop. Because these are our postural muscles. These are what give us problems when we're sitting at a desk too long, or we're on a computer too much. So Lindsay, you just tell me when you feel a little bit of a pressure.
Yeah.
She should feel the pressure right about now, because I can feel this needle right into the knot. Now, in some techniques in dry needling, you actually can take the needle in and out of the knot repetitively, and that creates sort of a micro trauma, and it increases the rate of healing. In most cases, we don't find that it's necessary to do that with every single knot you find. Sometimes in your athletes, if you're working on the gastrocs or the calf muscle, or you're working on areas of the lower leg, any of those spots, sometimes you have to do that just to make these knots be affected with it. But in the upper traps, the mid-rhomboid area, it doesn't typically do that. Have that effect, so you don't have to do that as often. Sometimes just a needle in the knot itself is enough to dissipate it. So we'll do one more right in here. Okay. We just take this in really gently. She'll feel it right about here. Okay. That one went just a little bit deeper because it was a heavier knot. On this side here, we'll come around to this shoulder blade here. Thank you. And Lindsay, if you'll take your arm and kind of put it behind you. There we go. This will lift, when she puts her arm behind her, it kind of lifts the shoulder blade, the scapula, away from the rib cage. And this allows access from the subscapularis muscle and into these rhomboids and mid-traps. And this is a really common area. So to get these accurately here, we'll just get behind. Here we go. Tell us when you feel this, Lindsay.
Okay.
Right there. Right in the subscap here. Just let that arm relax. Just have it right there. There you go. And what you'll see as the needles sit, we usually leave these in depending on the criticality of the problem. If it's something that the patient's been dealing with for a long time, we'll leave them sitting for 7 to 10 minutes. Sometimes it evokes a twitch and the knot is gone. We can take the needle out. Other times it takes a little bit more time. We leave them sitting from anywhere from 7 to 10 minutes. So right where the levator scap is on this side. So all around the shoulder blade, and you can relax your arm now. Just let that relax. So that allows that needle just to sit right in that subscapularis, and it right now, see, it's already loosened up, and this muscle is pulling away now. So you might even be able to feel a little bit of that. And we're gonna do one more, and that should be plenty. And that's right at the start. Here we go. Start of the upper rhomboid minor. Tell me when you feel a little pressure.
Okay.
Okay. So what we'll do is, this is just a basic example of some areas within the traps and rhomboids and around the shoulder blades that typically get tight on patients and where these trigger points develop. Most of the time we don't have to do this more than once, maybe twice. Sometimes you have to do it a few more times, but really dry needling is so effective in how quickly that it works in dissipating these knots. You don't have to do it that often at all, and it has a really good long-term effect. So, of course, the very things that cause these knots to develop to begin with are, postural, ergonomics, things of that nature. Repetitive use injuries, they can also contribute to knots. So we'll leave these in her for about 5 or 6 more minutes because they've been in for a little while. So that should be good. But if you guys want to see more dry needling, we'd be happy to show you. Or if there's other procedures in the office you want to see, we'll be happy to show you. And then maybe we'll make an announcement next time so y'all can chime in and ask some questions, and maybe we can do some live question and answer. So hope y'all enjoyed this. Well, take care.